Medicine du Monde has wide experience in running harm reduction programs around the world. Having been present in Tanzania in Kagera region since 1992, Medicine du Monde opened its first African harm reduction program in 2010 in Dar es Salaam, Temeke district. Drug abuse is an entrenched behavior in Tanzania. Drug use increases the risk of spread of infectious diseases such as HIV, hepatitis B and C. Globally, sexual transmission of HIV continues to be the most common way the virus is spread, but drug use is increasingly contributing to the pandemic. Worldwide repressive efforts directed at consumers impede public health measures to reduce HIV/AIDS, overdose, and other harmful consequences of drug use. The Global Commission on Drug Policy, in its June 2011 report, encourages governments to offer health and treatment services to drug users, to implement syringe access and other harm reduction measures that have proven effective in reducing transmission of HIV and other bloodborne infections. According to a pragmatic and evidence-based approach and following the signature of a Memorandum of Understanding between the Ministry of Health and Social Welfare and Temeke Municipal Council, Medicine du Monde started a needle exchange program, a first of a kind in sub-Saharan Africa.
The first case of HIV/AIDS was reported in 1983, and since it was reported in 1983, it became a new disease, and it evolved. It was a very rare disease, but at the time it has evolved into being a common household problem, affecting most Tanzanian families.
We've found that people who are using drugs, particularly those who are injecting drugs, overall around 40% of their clients are HIV positive. And this is very high when you compare with the general population, which is nowadays around 5%, 5.6, 5.7%. So that's very high. And when you look at female injection drug users, the percentages are even higher. They are in the 60s, 60 to 67%. In Temeke now we are getting figures of 67% among female injection drug users. So that's quite alarming. And you know, these are people who are living in the community. And if they are positive, it means they are a very high risk group because they interact with other people. And when they go out there, they can have sexual relations with other people, and they can actually become a very, very high risk group in the community.
Kuja kugundulika hospitali kama unaumwa kifua, hawezi kuanza kula dozi za kifua. Kwanza lazima upime virusi vya HIV. Kaenda nikakubali kupima HIV, nikajulikana kwamba mimi ni mwasilika, au sio bwana, naishi na virusi. Fikia hatua hadi dukani unaenda mabomba sisi kwa tunakatazwa kuuziwa. Ndio unakuta usiku muda mwingine la bomba sisi hatuna, mimi na bomba langu moja au bomba lake yeye moja ile alolitumia mchana. Inabidi yeye na jinsi usiku saa 5. Maduka shafungwa. Inabidi mtu sometime unakubali tu mwenzako unakotokea kumwamini. Kwa ile bomba anapigia yeye na mimi napigia. Na kwa yule pale mimi niko nimepata story yake kama yule alikokuwa mwasilika.
Mimi mwenyewe binafsi yangu nimekuja hapa nikiwa bado natumia dawa za kulevya, nimetumia kwa muda wa miaka 10. Nilianzia kwenye bange, nikafikia kwenye kuvuta tu hivi kwa kutumia sigara, nikafikia na mimi kwenye kujidunga. Hivyo ninavyovisema ina maana tabia zote mimi nazifahamu. Maana na mimi mwenyewe pia nilikuwa mlengwa.
It's very important that people understand the basic concept and idea of harm reduction. What we're trying to do is to reduce the harms of drug use, which are basically diseases. And this involves education, distribution of condoms, distribution of needles, and also the general health and well-being of our beneficiaries.
It's definitely useful to have the exercise that MdM is doing in Temeke, which is, in brief, we call it harm reduction interventions. And we have, between the Ministry of Health, Temeke Council, Municipal Council, and MdM, we have a memorandum of agreement. to provide harm reduction services in Temeke. Training is aiming to improve the capacity of our health workers at different levels in the municipality in Temeke. Some local NGOs within Temeke who are interested in supporting people with addiction problems, just improving their competence in handling such problems. Secondly, is a drop-in center where they invite people who are already using drugs, particularly those who are injecting drugs, to come into the drop-in center, and they are given some education about how to reduce harm or to use, even if they continue using drugs, they do so with less risk of contamination.
The main purpose of the program is to prevent HIV infection and hepatitis G among drug users. And during our services, we provide education concerning harm reduction to injecting drug users and also other community members. The equipment we provide to them is contained of a syringe, sterile water, alcohol swabs and a condom.
Programu inasema harm reduction maana yake ni upunguzaji wa madhara yatokanayo na madawa ya kulevya, kwamba ni bora usitumie, lakini kama unatumia utumie ikiwezekana uvute, au kama unapenda au unataka kutumia sindano, lakini utumie katika njia zilizokuwa salama, na utumie sindano moja, ni usishare sindano, utumie sindano moja kwa mara moja, utumie material yaliyokuwa masafi. Ndio maana harm reduction, upunguzaji wa madhara ili kujikinga na HIV na maambukizi ya homa ya ini.
We assess the needs of the injecting drug users and the non-injecting drug users, and we had to adapt our program. We had to adapt to the needs, the demands of the women injecting drug users. We had to adapt to our VCT services, increasing the number of hours, and forming groups for smokers, for smoking heroin users.
Substance abuse, drug misuse is one of the mental disorders. It's usually a problem of addiction, that people use those substances like alcohol, heroin, cocaine, and they habituate. The interaction between the person and the drugs takes them to a state where they need to have the drug to feel okay.
The situation in Tanzania in terms of injecting drug users is critical. Although there's not yet a sized estimation in the country, but it's estimated generally we have about 25,000 injecting drug users nationwide.
Kuna miradi mingi ambayo inaweza kufanywa katika upunguzaji madhara. Kwa mfano kuna mradi wa ubadilishanaji wa bomba ya sindano. Ni mradi ambao unalenga kupunguza madhara, mkakati mmoja wapo.
You bring in a used needle and you get a clean needle. And the idea here is to ensure that people don't share contaminated needles, which fuel the transmission of HIV. And hopefully, if majority of the injection drug users can access clean needles, it means that the transmission between clients is going to be very low, or it can be down to zero.
Utafiti uliofanyika imeonekana kwamba hakuna vijana ambao wameweza kutumia dawa kutokana na kwamba kugawa syringe. Kwa hiyo tungeomba kwamba jamii elewe kwamba tunapogawa hizi syringe ni kwamba yule kijana penda usipende, akikosa syringe atatumia ya mwenzie, kwa hiyo ataambukizwa. Kwa hiyo ni bora kumpa ile syringe ili ajikinge kuliko kumwacha kabisa, kwa sababu kwa njia yoyote lazima atashare na mwenzake. Kwa hiyo naomba ili lieleweke kwamba si kwamba tunachochea matumizi, ila tunajaribu kusaidia vijana hasa kwa maambukizi ya magonjwa kama ukimwi.
On Monday, from 12 hours, we have a class with them We gather them in a room and we provide them education, how they can live properly in the community, and the other things concerning moral issues and how themselves they can fight their rights in the community. Other services we provide is clothes for those who are in need, because the kind of people we are saving, most of them are living in very poor conditions, in very poor environment, so they don't have enough clothes. So we provide for those who see they are in need of it. We also provide foods for those who also are in need. For example, most of the female we have in our program, most of them they are babies, so they don't have enough money to sustain their life. So we provide some food to them. Apart from that, we help them to make feel valuable through education and counseling, because most of them they've been discriminated in their families, in the community, even other people who are not considered them as a man, for example. So, for example, they fight with the police patrol in their street, they always seem as the criminals. So we help them to make that they have their rights to live and to do things as a human being.
Tunatoa mafunzo ya utumiaji kondomu kwa usalama zaidi. Na hapa tumepanga siku maalum kwa ajili ya madada wale wanaotumia madawa ya kulevya. Ile siku tunakuwa na mazungumzo juu ya kiafya. Ile siku tunakuwa na mazungumzo juu ya utumiaji kondomu salama. Ile siku tunatoa chochote kama kuna chakula tunawapa, wanafua, wanaoga.
It's hard for the community sometimes to realize that what we are doing is to bring these people to the point where they can respect and value themselves. What we're doing is we're trying to bring these people back their humanity. Something as small as a meal or a shower makes somebody feel human again. Somebody who has not taken a shower maybe for a week. If you give them a shower, just that, it makes them feel like a human being.
Na matatizo ni mengi sana kwa mtumiaji madawa ya kulevya. Kwanza polisi, yani ndio kwa usumbufu mkubwa sasa kwetu sisi, yani tunakosa amani, kwa hilo nakosa heshima mtaani. Nazalolika kimtaa, siaminiki kivyo vyote vile.
This year MdM started a participatory video project. The name of this project is Giving the Voice to Youth at Risk. Our first objective is to provide mental and physical engagement, where we first try to discover some talents which are available within the members of the club. The second one is skill transfer, where we transfer some skills to the member, such as writing, using of video, speaking in the public, and all kind of skill that will help them in creating short stories about their community.
Nikuja MdM sijakurupuka tu, nikapata taarifa kuhusu MdM kwamba ni sehemu taasisi ambayo ni madaktari wa ulimwengu ambao wanawalea watu fulani ambao wanatumia madawa. Jicheki mimi ndo vile kana acha niingia hapa nje kupata huduma fulani. So madawa tu wataka kusombwa HIV, kuja kuchukua kinga. Hagai madawa ila vitu vya kujikinga utumie salama. Kwa mfano silinja kuja kuchukua hapa. Na zaidi kinachonivuta mimi hapa ni katika kuna taasisi kikundi ambacho cha vijana wenzangu ambao huwa tunabadilishana mawazo, ambao kundi hicho ambao wanaitwa PVP ndio nipo mimi. Kuna fursa nilikuwa siipati mimi kama mimi na katika harakati zangu, lakini PVP naipata fursa ya kuongea na kuwa free, yani kuelezea hisia zangu kwa jamii. Kwa sasa hivi bado, lakini katika kimtazamo katika maendeleo zaidi inaonekana kuna picha nitaipata, sio Tanzania tu, labda habari zangu watu waelewe dunia nzima sisi tunafanya kitu gani.
Future plans is to mobilize resources, to have more of our health workers trained, to have better awareness in the community of the high risk that is associated with the injection drug use, and to make sure that those who are in need of services, as much as possible, they have access to high quality services.